Hello, everyone. My name is Jonathan Sullivan, and I'm the Vice President of Product and Membership Design at the National Quality Forum. Welcome to our latest program on COVID-19. We're glad you could join us, and we hope it'll be informative. This program is made possible by you, the members of the National Quality Forum. Members are the driving force behind NQF's mission to advance measurable health improvements. Together, we do the work that enhances healthcare value, makes patient care safer, and results in better outcomes. Today we have a panel on the effects of COVID-19 on food insecurity. As the COVID-19 pandemic continues, many Americans are having to choose between staying safe and being able to feed themselves and their families. Food insecurity is a complex problem that disproportionately affects many of the same populations that are most affected by COVID-19, including the elderly, low-income individuals and families, African Americans, and those in principal cities and non-metropolitan areas. Today's panelists will share their perspectives on the impacts of COVID-19 on food insecurity and what actions healthcare organizations can take to overcome food insecurity in their communities while also battling COVID-19. Some quick logistics as we get started. We hope that you'll take an active role in the question and answer portion of the program. However, please help us stay on topic and refrain from questions or comments that aren't related to the information being shared today. We've muted all phone lines to ensure that unexpected noise does not interfere with the program. We will be taking questions through the web interface and through the phone lines. If you're on the web, we're displaying the instructions right now about how you can ask a question, and we'll redisplay these when it's time for Q&A. If you're only on the phone and unable to see the instructions, I will prompt the audience when it's time for phone questions. At that time, you can hit *7 on your phone to unmute your line, and when you've asked your question, please mute your line again by hitting *6. So with that, I'd like to turn it over to Poonam Bale, a Director of Quality Innovation at the National Quality Forum, who has been leading our recent food insecurity projects. Poonam, you can hit *7 on your phone to unmute.
Thank you, Jonathan. I appreciate that. So thank you, everyone, for joining us today. I'm excited that we were able to get this panel together to have this important conversation as we are trying to see how to focus on food security while also understanding the limitations of COVID-19. I would like to introduce our panel members. First, we have Lauren Schweder Bale, who is the Executive Director and co-founder of DC Greens, a nonprofit that works to advance food justice and health equality in the nation's capital. Since launching DC Greens in 2009, she has received many local and national awards and honors for her work as a community builder, nonprofit leader, and strategic thought partner in building a healthy and equitable food system. She has served on the DC Mayor's Commission for Healthy Youth in Schools, has co-chaired the Diabetes Committee for DC Health, and acts as an advisor to the DC Food Policy Council. Next, we also have Richard Stewart. He is the Director of Innovation Partnerships at Children's HealthWatch. In this role, Richard leads the cross-sector policy work initiatives of the organization. In close collaboration with the Children's HealthWatch principal, investigators, and executive director, he identifies and executes a wide range of projects grounded in research, policy analysis, and advocacy to inform and influence policy decisions and improve children's health. Richard's multi-pronged profile includes leadership of the Children's HealthWatch social vital signs communities of practice, as well as strategic and innovative partnerships with other national organizations, researchers, and policymakers to advance the missions of Children's HealthWatch. We also have Jennifer Spear with us, who is a population health strategy lead with Humana's population health team. With a diverse background in business, sales, and marketing, Jen is in charge of executive interventions and programs that address food insecurity in Humana's member population and the communities that they serve. Additionally, she works closely with community partners, the clinical community, and other partners to address the health-related social needs food insecurity of people where they are receiving care. Jennifer previously led employee awareness strategies dedicated to raising awareness around the importance of social determinants of health and healthy days. Prior to her role working with food insecurity, Spear implemented member call programs that focused on healthy days assessments, which is how Humana is tracking progress towards bold goal that the community it serves will be 20% healthier by 2020 and beyond. Thank you to all three of you for joining us today. So today we wanted to start with really a little bit of a background question. We have all been involved with this work for a decent amount of time, but for the ones on the call, first I would ask you to describe food insecurity. How do you see what is food insecurity? And then if you could share some impacts of COVID-19 on the food insecurity within your community. And we'll start with Lauren.
Great. Thank you so much for convening this call on this really critical topic, and thanks for having me. So the first thing I just want to do is a little bit of level setting, make sure that people understand, what food insecurity means. Food insecurity is basically the term that folks have been using to replace hunger. Food insecurity is often measured with a food insecurity screening set of questions that gets at the question of whether you have been nervous or worried in the past 12 months about whether you are going to be able to feed yourself or your family. So it really gets at the question of anxiety about having enough money to be able to feed your family. And what studies have shown is that when someone screens positive for food insecurity, there's a significant increased risk for a number of diet-related chronic illnesses, mostly because it means that you're making very hard choices about how much food, what type of food. Often you're buying lowest common denominator food. And I will say in the introduction, it was flagged that we have sort of the same populations experiencing food insecurity in this country as we see experiencing high mortality rates. And I just want to underscore, that's not by accident. These are connected because, a lot of the evidence shows that, folks who experience food insecurity, there is this increased risk of so many of these diet-related chronic illnesses that we're finding to be underlying conditions for increased risk of COVID mortality. So, this is an important issue all the time, but I think it's really, there's a very clear spotlight on the connection between food insecurity and health equity. I will just also add, because I want to give time for my esteemed panelists, co-panelists, but by some estimates, recent estimates, there's an increase of food insecurity due to COVID and to sort of loss of employment. Some estimates actually are placing food insecurity at 38% of adults nationwide right now. That came out of the Department of Sociology of University of Arkansas. And I know on a local level, our capital area food bank here, had to buy 45 trucks worth of food in March. And normally that is what they purchase in a full year. So there's a very dramatic increase in food insecurity that I know we're seeing here in the District of Columbia.
Thank you so much, Lauren. Rich?
Yes, thank you. And thank you, Lauren. That was a great way of describing, exactly what food insecurity is. And, we've, as a country, been able to measure it relying on the gold standard USDA tools for a number of years now. And healthcare providers are able to briefly screen for food insecurity using the Hunger Vital Signs screening tool to identify households experiencing food insecurity. But the impact as a result of COVID-19 on food insecurity in my community, in my backyard here in Boston and Massachusetts, we've known that pre-COVID-19, about 9% of residents in the Commonwealth experience food insecurity. But as of March, according to data from a great organization in Massachusetts, Project Bread, we now know that 38% of people in the state are experiencing food insecurity, which is an astonishing increase just in the past month. And the sad fact is that I'm sure that number is much higher today. And it will take years for this impact on food insecurity to decrease. Children's HealthWatch, the organization that I work for based at Boston Medical Center, has looked at the impact of food insecurity on young children and their families over the past 21 years. And for those families, it's been much higher than the official rate among families in Massachusetts and in the United States. And we've seen that the food insecurity rate among the families that are served at Boston Medical Center before COVID-19 still hadn't decreased to pre-2008 Great Recession levels. And so to understand how this will have a long-term impact on young kids' health is incredibly important. And that's in a brief summary what we're seeing and what we're anticipating going forward.
Thank you, Rich. Those numbers really drive home how serious this issue is. Jen?
Hi, everyone. Thank you. So from a health plan perspective, I'm going to, Rich and Lauren did such a phenomenal job of describing what food insecurity is and how we as a health plan view it. So I'm going to kind of jump into the second part of the question that they were talking about. And so when I think of from our community, what that looks like, I and Humana are located in Louisville, Kentucky, where we're certainly seeing the impacts and increase in food insecurity. But I also have to think of this much more broadly as we are a national health plan, so thinking across the country. And so we know our members prior to COVID, we knew that about, from our predictive analytics, 20 to 30% of those members were food insecure. What we're finding now, though, is that members are calling in not because they're concerned about getting to their doctor's appointments or not because they're concerned about getting their medications refilled. While those are certainly concerns, the concern that has really bubbled to the top is members not knowing where they're going to get their next meal and how to get food for the week and all of that. So although Humana has been focused on food insecurity for a number of years, we've really seen this amplified in times of COVID. We already serve a very vulnerable population. Members, but a good bulk of our membership is over the age of 65, so they're being told to stay at home. So those folks who maybe did rely on the charitable food system before, they're not really even sure how to access it anymore. So they're calling in as kind of their last line of looking to Humana to help address that most basic need for them. We know, and as I mentioned, 20 to 30% were food insecure before COVID, so we know that certainly didn't go away for those members, but now additional members are having issues with accessing and affording food. We've also looked at the need to address social determinants of health within established programs, so making sure that when we are outreaching members for their clinical needs, our care managers are calling to talk to members about what's going on from a clinical perspective, making sure that they're also addressing those health-related social needs. So again, to the point that Rich and Lauren made, we know this is lasting and long, and we know that we've had to figure out how to help the members who were already food insecure, but also know that we're going to have a lot more. The prevalence rates are going to go up, and so we just have to think how to address in the immediate term, but also what does that look like long term? This is not going to, there's no light switch that's going to come on and fix all of the issues that have been identified to date. So how do we think about, through benefit design, through programs we support, through community partners, how do we really plan for the long term and work together? So
thank you for that, Jen. So I'm ready to move to the next question. Before I do, I want to check in with all the panelists. Did you want to add anything else before we move forward? Okay. So my next question is about healthcare organizations and providers are already facing many challenges while battling COVID-19. Why should a healthcare entity be implementing strategies to improve food insecurity or even be thinking about food insecurity during this time. Rich, why don't we start with you?
Great, thanks. I know how hard my colleagues are working on the front lines to address the immediate impact of COVID in our communities. But for the perspective of a healthcare institution, taking a holistic view of the challenges that they face during this crisis, I think that addressing food insecurity should really be top of mind among the strategies and tools at our disposal to counteract COVID-19. And why is that? Well, we know that the underlying health conditions like diabetes, hypertension, kidney disease, and others that are associated with higher risk for and worse outcomes for those who are struck by COVID-19 are also directly related to food insecurity. There's a clear link there. And so from the perspective of a healthcare institution, addressing the community's food security needs, helping patients manage those chronic underlying health conditions is important and the right thing to do in and of itself for that patient's health. But it also offers some sort of preventive medicine, some sort of buffer to those patients as well, and kind of addresses in some small way the risk that they face.
Thank you, Rich. Jen, we would love to hear your insights on this, especially since Humana did graciously fund the work that MQF has been doing on food insecurity, to hear the rationale about why you initially funded this work, but then also why you still think it's important for this to be a priority.
Sure. So the work from Humana related to not only food insecurity, but social determinants of health in general dates back quite a number of years. And we feel it's so important to invest in this work with the implementation guide and additionally with looking at putting some quality measures around food insecurity, because we think that consistency is really important. And as we work with physicians, clinicians, we work with community partners, when we're able to establish that consistency, I think it actually helps us to be better positioned to react to crises like this, to disaster and to crisis. And so that's really one of the main reasons that Humana supported the development of food insecurity screening referral measures, but also why that implementation guide is so important. And I know we're going to talk about the implementation guide later, but whenever we can bring together all of the different players, if you will. So obviously this panel is a wonderful representation of all of those, but how each entity and each area really plays into the solution. And so, from a health plan, when we think about quality measures, it's really important that as an industry, we're able to think about and acknowledge the work that our charitable food system and community-based organizations are making, because when we are referring for us members or patients over to them, that's what's really improving health. But we can't do that until we identify that that's actually a need. So from Humana's perspective, it's so important to build that body of work and to continue to contribute in that way. And we think that standardized measures is one of the first ways that we can get there to really not only identify needs, but also in a somewhat streamlined approach, be able to address them, be able to show the improvement in health that we all know is coming from that, and then in a longer-term perfect world, be able to reimburse for those types of outcomes.
Thank you, Jen. Lauren?
Yeah, I mean, I obviously I agree with everything that the other panelists have been saying. I think one additional thing that we've seen in this moment, DC Greens runs a produce prescription program, and so we've got a lot of partnerships in place with federally qualified health centers and health providers across the district. And in this COVID moment, we started getting calls from some of our clinical partners particularly ones that were running respiratory care clinics, and were screening for food insecurity and recognizing that they were, telling some of their patients that they needed to self-quarantine either because they were believed to be positive or, were high likelihood or in fact had screened positive for COVID-19, but were coming up as food insecure. And, it was really a very acute need in this moment from a sort of a broad public health perspective to make sure that these patients that really needed to stay home for the sort of greater common good were actually able to stay home, and had food in place to be able to follow that sort of very basic and critical public health recommendation. So I think that was sort of a new, really critical need for food intervention around food insecurity, and obviously so important that our clinical partners who are doing that kind of respiratory care work, have integrated these food insecurity screeners into their workflow so that they were actually able to kind of sound an alarm, both to us and to the district more broadly, that, we needed to have something in place to make sure that, food insecure COVID-19 patients actually were able to self-quarantine. Another thing that I'll just flag, coming off of what some of the other panelists were saying, in the sort of food as medicine world, which I'm sure many of you are familiar with, and there's a number of different types of food as medicine interventions that people have been piloting and testing and getting really interesting clinical results around, for the past many years now. There's sort of a spectrum that goes from prevention to treatment, with sort of the treatment being, things like medically tailored home delivered meals and kind of working down into, with whether it's fresh food pharmacies or produce prescriptions programs, and then the kind of broadest prevention intervention is sort of the SNAP program, the sort of, large federal benefit programs that help with food insecurity. But I think one thing that's been really fascinating to me in this moment is that a lot more people are paying attention to that prevention side of the equation, and I think because the really clear connection between food insecurity and diet-related chronic illnesses that are these underlying conditions, I think is being put in just very clear relief. And so I'm hopeful that, these types of conversations that we're having and the kinds of investments that Humana and some other, MCOs and insurers have really been making for a number of years really do become the norm going forward, so that we're not kind of scrambling in a crisis, but that we're in a position to avoid this kind of crisis into the future.
Thank you, Lauren. Did any of the other panelists want to highlight anything else about this question? Okay. So then the Food Insecurity and Health, Overcoming Food Insecurity Through Healthcare-Based Interventions Implementation Guide was released in late February, right before COVID-19 became a major crisis in the U.S. So many things have changed since this came out. What strategies in the guide do you think would be most useful to healthcare entities attempting to start or maintain a food insecurity program during COVID-19? And are there any innovative approaches that you and your organization have taken to tackle food insecurity during this time? Jen, let's start with you.
Sure. So I think just from the guide itself, there's two major components of it that I think are really important right now from my perspective. One of them is emphasizing the importance of food insecurity within the healthcare system. As I mentioned, Humana has been doing this work for a number of years, but I can't tell you the number of folks, care managers, senior leadership, our market point agents, our sales agents, all of these associates of Humana who are reaching out to me really with this higher level understanding of food insecurity now. And not that they didn't have it before, but I think that this has just been so amplified by COVID that it's absolutely impossible to ignore. I've gotten every every news article related to food banks facing shortages and facing long lines. And so, again, Humana has always been invested in this work, but I think now it is just so much more top of mind than ever. Taking that from the guide, this should not end after COVID. Obviously, this issue of food insecurity is still going to be amplified once states start opening up. We look at they're very, very possibly, quite probably going to be spikes. We might go back to more of a quarantine state, but as this work continues and as we move along in this new normal or whatever normal looks like, just making sure that this importance of food insecurity and the relation between food insecurity and health is top of mind within the organization. Additionally, along with that, establishing processes and procedures for screening, intervening, and tracking these food insecure individuals. Again, as Puna mentioned, this came out in February, and so one thing that really wasn't being considered then and that we didn't necessarily think to address is the role of telehealth in our clinical world right now. So thinking about how we establish these processes to screen, intervene, and track through all mechanisms of delivery in healthcare. So those are kind of the two strategies that I think are really helpful right now. The other reason I would say this, establishing the standard process to screen and intervene, is somewhat related. So, as we think about from a health plan and a healthcare lens, we are all accountable to Center for Medicare, Medicaid, CMS in one way or another. And so when we can really track and establish uniform procedures, we're helping to make sure that the validity of our programs, the validity of what we're all offering is there, and quite frankly, protecting all of us from any risk that we, didn't offer anything uniformly. I think one of the things that's so important, and this is what has been at Humana, but I think will, again, just be amplified based on the current state, is having an organizational culture that's attuned to addressing social determinants of health and reducing health disparities. Obviously, this focus is on food insecurity, but we also have a focus and know that loneliness, again, has always been an issue, but is going to be more broadly amplified from now and for years to come. And so having the organizational culture that takes on ownership to more broadly include social needs within patient populations, to really understand the root of that food insecurity. Is it really about access or is it financial? And probably some mix of both. But whenever the organizational culture allows for that that permission space, if you will, to really address the needs of members and to talk to them and identify those needs and figure out the best solution for them, is where we are going to have the best outcomes for the populations that we serve. I think one innovative approach that I would just touch on that Humana has taken and kind of relates back to a point I made earlier, very early on, whenever stay-at-home orders were going into place, had members calling in who were so concerned that they couldn't get food. And so Humana quickly deployed our basic needs program, which is allowing emergency meals to be sent out to those members. This is something that, was not necessarily in the plan prior to COVID in the state that we're in, but we know that our community partners are strapped in a number of ways. And so figuring out how we can help direct those members to the community organizations who are most adept to help with that need, but also how in the interim do we make sure that those members don't have to worry about how they're going to eat tomorrow. So thinking about kind of a very short, immediate impact, and then how do we make a more longer-term impact is one of the innovative things that I'm proud to say that Humana has quickly stepped up to take on for those members that we identify are having issues accessing or obtaining food.
Thanks, Jen. It's great to hear that. Rich?
Yeah, and to build and support what Jennifer just said, I think for organizations attempting to either start or maintain a screening and intervention program during COVID-19, the guides recommendations on clinical action, I think, are really useful, especially the recommendation to be prepared to build institutional capacity both within and outside the organization to launch and sustain these types of initiatives. To give you an example, here at Boston Medical Center, and specifically in pediatrics, we're completely rethinking the way that we utilize our capacity. So how we proactively reach out to families in this time and how we screen, but most importantly, how we're adjusting and adapting the way that we offer resources to families. So, we're sort of drinking from a fire hose at the moment. We're standing up new programs. We're supporting our external partners in different ways and really just trying to be as nimble as possible. And so for the individuals and the organizations listening in today, I think looking at those clinical action strategies could be really helpful at this time, thinking about how you can either establish or adjust the work that you're already doing in this area to best meet the needs of the families, the households that you serve.
Thank you, Rich. Lauren?
I would agree that, I think one of the things that the guide really underscores is how important it is to just build awareness of sets of issues. And I think, this is a really key moment and sort of like a perfect object lesson in why, food insecurity and health equity go hand in hand. So, I think that is clearly something that everyone can be doing at their organization, sort of regardless of any other levels of intervention that might be able to be deployed. I would also say that, for those of you who are sort of trying to stand something up quickly in this moment because, this is the first time that your institution has sort of recognized the need for sort of deeper investment in this area, I really would want to underscore something from the manual about how important it is to integrate screeners or interventions into the regular clinical workflows. I think, we've certainly found that is sort of the critical piece to uptake. And obviously everybody's workflows are very crammed right now, and everybody's sort of in a hectic space within the healthcare space. But I think, as much as you can find places where, something can be integrated into, any kind of care coordination team that you already have in place, that is going to set you up for both short-term success and give you a kind of a foundational building block for longer-term success. I think from the sort of emergency food provision side of things, this has been a moment where everybody is really working to innovate and to, a lot of our emergency food system is set up for people coming out and standing in lines or, very high touch moments, congregant meals, things like that. And I think everyone is really working to figure out sort of new transportation models. And, the truth is I think that I'm sort of a silver lining kind of person, but I feel like there are a lot of solutions that are being figured out right now that I'm hopeful will be able to serve our society and our healthcare system even more strongly into the future. The sort of medically tailored home delivered meal sector has almost been the best positioned to be able to respond in this moment because, they're already doing home delivery. I think, those of us that do produce prescription programs or, food boxes, we've all been working very hard to forge new kinds of transportation partnerships with rideshare services, with, folks that might be out of work, from trucking companies. And, these are potential new business lines, honestly, for these transportation industries. And, once they often say, necessity is the mother of invention. And I think, we are in that inventive moment. And I'm hopeful that, the types of things that we're setting up will be able to really be supported by our healthcare system into the future, to be able to, support member health into the future.
Thank you for those insights. Would any of the panelists like to add anything? Okay, so the implementation guide emphasizes the need for partnerships and collaboration with other healthcare and community partners to address food insecurity. We've also heard many leaders tackling COVID-19 also cite the importance of partnerships and collaboration to address the outbreak. How best can healthcare organizations collaborate with each other, community partners, patients, and their caregivers during this time to address food insecurity? Lauren?
So, I think in some ways, unfortunately, because of the way that our healthcare system, HIPAA is wonderful. Obviously, patient confidentiality is an important thing. But, I know that for us, it took us about 3 years to get through all of the sort of legal requirements to be able to have a kind of a seamless interface with the healthcare system here. And, unfortunately, there just isn't that kind of time to be able to really set up deep new partnerships. I think that, there are many other folks like us across the country, community partners that are already in, strong relationships with their healthcare systems. And I think what I've seen is that, those are the ones who are best able to scale right now, best able to communicate, to pivot. You already know who your champions are inside of the clinics or inside of the, MCOs or the systems. And that's where, kind of creative partnerships have really been able to innovate and scale. I don't mean to say that to be discouraging, because I do think, this is the moment where there's a lot of will across systems to try to forge these partnerships. And I would encourage everyone to sort of get balls rolling where they can, because this is not, as I think Jennifer said, this is, unfortunately, we're going to be in this for a long time. And, this realization we're having right now, that so many people are finally having right now, that, these are key issues that have to be addressed together, that's going to continue to be true. So I would encourage people to, start conversations and try to, get partnerships off the ground. But I think you can't expect that you're going to be able to snap your fingers and have a solution. And I've been getting calls from, folks on the food access side of things, saying, oh, I'm getting all these calls from healthcare systems that want us to stand up a produce prescription program. Can I do that in a minute? There's no way to do it in a minute. And so I do want everyone to sort of temper a bit of their expectations around what the food access provider in your community will be able to do on the fly or, very quickly. I will say, though, that it really is very important. Partnership works at many levels. So there's the sort of very deep shoulder-to-shoulder partnership, but there's also just, making sure that you have the most up-to-date information about what's happening, in your city or your community, because, everybody that's working in emergency food access is, working triple time, just like the healthcare system, to make sure that things are being stood up, that there's access for children who are out of school, that seniors are getting food, and, making sure that you're in touch with, whether it's a branch of Feeding America or a branch of the Food Research Action Center, just really being able to get a sense of what's happening in your community so that, you can support your members with that clear information, I think is sort of the easiest first step.
Thank you, Lauren. Jen?
Yeah, I would echo everything that Lauren said, and I feel her pain on some of the weeks, months, and years, more on the months and years that it takes to get some of these really deep-seated partnerships stood up. So, again, completely agreeing with everything that she has said. And I think from our perspective, and when I'm speaking about this from the lens of a health plan, I've seen some really innovative things come out of some of our markets. And to Lauren's point, those couldn't have come out if there weren't long-standing relationships where our Humana market advisors and have been working closely with their local community-based organizations and working closely with their healthcare partners. One, really actually tying back even to Lauren's point earlier and the last question about different ways of thinking about transportation, just one example to highlight is we were able to identify New Orleans by working with partnership between Humana and one of our regional physician partners and the Feeding America Food Bank, their Second Harvest Food Bank, were able to help identify that there was a need for transportation help. So Second Harvest just wasn't able to get all of these meals that they had delivered to vulnerable seniors. And so because our relationship from that local level is so deep in New Orleans, we're quickly able to determine we had a physician partner who has vans and drivers who were sitting because those are not, they're obviously patients aren't coming in for their well checks and for the appointments that those vans would be used for. And so through all of those connections, we're able to establish that those drivers and vans could be deployed to Second Harvest to actually help deliver that food. Just a different way of thinking about that collaboration and what that partnership looks like. I think from the point of, whenever those deep-seated partnerships aren't there, so I've mentioned Humana is, really we're a very large Medicare Advantage plan. We have a smaller number of Medicaid members, but realizing they have a very different set of unique needs. And so sometimes in those new partnerships that we've really realized we have to support the community-based organizations who are impacting our Medicaid population. If the partnership isn't as deep as some other areas, I see the value from the Humana perspective, not the value, sorry. I see our role is to just support them to do what they have been doing for years, what they know how to do best, and quite frankly, get out of their way to let them do that. For instance, the Humana Foundation deployed recently $50 million in short-term and long-term relief and relief efforts to national and local partners. This was for immediate need. And so typically whenever we'd be working with partners, it would be on something specific. But our role in this is to support and know that, within the communities that we are supporting, in turn our membership is supported and those that we serve are supported. And, for lack of a better way to describe it, just step out of the way and support, but to allow those organizations to do what they need to do, with the goal that once things settle down a little bit, we want to develop those deep-seated partnerships, but this is not the appropriate time to really try to figure that out. So a couple of different ways of thinking about it there, but that's just a few examples of how we've addressed our community partnerships, especially during this time.
Thank you, Jen. John, Rich?
Yeah, I think Lauren and Jennifer really hit the nail on the head with this. Collaboration is more important now than ever before. Healthcare alone, the charitable food network alone, even government alone cannot solve or address this by themselves. And so it's important to have those long-standing, deep partnerships taking place. But now is as good of a time as any to reach out to new partners and begin to build those relationships and address patients' food security needs. And, I think what Jennifer was just describing in terms of the Humana Foundation, to the extent that healthcare partners can reach out and provide financial support or material support to the community-based organizations that are on the ground doing this work, the food banks, the meal delivery services, those types of organizations, I think that's going to have really the biggest immediate impact Really this is about addressing the acute need, and then again, to reiterate, thinking about the sort of deep partnerships, the sustainable partnerships going forward to move further upstream.
Okay, perfect. Thank you all. One more question before we open up questions from the audience. What is the biggest takeaway you would like our audience to remember? Let's start with Rich.
Great. My biggest takeaway is for healthcare providers, healthcare organizations to really become engaged policy advocates if they haven't seen themselves in that role prior to this crisis. I think that the public health and economic impacts of COVID-19 on households across this whole country has been incredibly devastating, and we can clearly see this in the drastic increase in food insecurity rates. And so the best medicine at our disposal to address food insecurity is the Supplemental Nutrition Assistance Program, or SNAP, sometimes referred to as food stamps. And we could talk for hours about how effective SNAP is at addressing food insecurity and improving health outcomes. And there's a ton of research out there on this, including from my organization, Children's HealthWatch, as well as many others supporting that. But the point is that the SNAP benefit amount, or the dose, if you will, is just simply too low, especially now amidst this pandemic. And so what I say to healthcare providers, you're the trusted and valued messengers, and you need to flex your advocacy muscles to ensure that Congress increases the SNAP benefit amount just as it was increased during the Great Recession. I think this is something that our leaders in Washington have failed to include in their stimulus and response packages. And so, everyone listening should stand up and let their voice be heard that increasing SNAP benefits is one of the most effective ways to help low-income families improve health and stimulate the economy during this time of immense strain.
Thank you, Rich. Lauren?
Yeah, thank you, Rich. I guess I would, many of us for many years now have been saying that the healthcare system needs to stop thinking of food insecurity as a kind of a charitable investment and really needs to start thinking about it as part of its core business line. And there are many insurers across the country that have been really piloting and testing and evaluating food as medicine interventions that are really designed to produce a return on investment for the healthcare system, whether that's, through actual sort of, a return on investment through clinical measures, whether it is, because there's ER diversion happening or medication compliance, or simply through member satisfaction and reducing churn. But, I would really encourage folks to remember in this moment that, this is really a burgeoning shift to our healthcare system that has been going on for, the past probably 5 years in a really strong way, with a lot of new evidence coming out. And, as much as you all can continue to lean into building that body of evidence that, access to healthy food really does improve health, really does bring down costs, I think we have an opportunity to really ensure that access to healthy food is a core component of prevention in this country, and our healthcare system is really a critical, really a critical partner in being able to, increase the financial support, for access to healthy food. So I think I would just want to encourage people to really stop thinking about this as charity and really start looking at this as a component of your business model.
Great point, Lauren. Jen?
Great points by both Lauren and Rich. And I think that I would just probably end with, I think the biggest takeaway that I have had and continue to see right now is that, obviously the need and the crisis is great and the work is nowhere near done. But one of the things that I have been going to use Lauren's words, an eternal optimist. There's a lot of innovative partnerships. There's a change in thinking. We're working agile. We're working quickly and thinking about, at least again from a health plan perspective, we're getting exactly to Lauren's point, even more so than before, that this is so important to health and to our business. And so I think that the biggest takeaway for me is not to let this work stop or slow down. Again, we're not going to return to normal for quite some time, but for no one to forget where we are in this state and how we are all collectively thinking about addressing not only food insecurity, but addressing all health-related social needs of people, not to let that work stop and to keep driving that work forward once we return to a state of quote-unquote normalcy, whenever that might be.
Perfect. Thank you, all three of you. This has been some great insights, and we're really grateful that you were able to join today. Before we conclude, of course, we want to do an opportunity for our audience to ask questions. Jonathan, I'll hand it to you to conduct that.
Okay, great. Our first question today is going to be from the chat, and it's from Ellen Blackwell. Ellen, do you want to take your phone off mute by hitting *7 and ask your question? Okay, I'm not hearing Ellen, so I'm going to read it for her. An issue I've noticed is that some people who are now food insecure, and some who are not familiar with how to cook. This is magnified when they are happily given food through food banks and other non-familiar sources. How do we address this secondary problem effectively? This is a question for the panel. Anybody want to go first?
Sure, okay. Sure. This is Lauren. I think, this is actually a question that in normal times comes up quite a lot around, people not knowing how to cook. And often it is sort of targeted, food insecure folks often don't know how to cook. And what I usually will respond is, unfortunately, as a society, across pretty much every demographic, people don't know how to cook anymore. So this is, I want to just make sure that we're flagging that this is sort of a persistent societal issue. I would also say that, quite a lot, particularly our elders in the community, the sort of seniors, really do know how to cook, and they know how to. They've in DC at least, they've been clamoring for produce. Specifically, really want fresh fruits and vegetables, and really do know how to prepare them. I think that one of the things that we're finding is that many folks, at least again I'm speaking from DC, there's been a surge in sort of meal production as opposed to just sort of grocery box production. So we have World Central Kitchen here that's been producing meals and has sort of an intake form so that people can get meals delivered through Uber. But I think there's going to be a range of solutions necessary. And I think, making sure that you've got sort of a meal option, a, produce box option, a grocery box option. We've been sending these quarantine boxes that have, frozen meals in them because obviously also if somebody is, seriously ill and home, even cooking and preparing that food is, is hard to imagine for anyone at any means. So I think as much as possible, making sure that there are a range of options possible. I also know that some of our folks that have been doing produce boxes have also been putting recipe cards into the produce boxes as a way of helping people. There's been sort of a loss of choice a bit, I think, again, across every demographic. So, people aren't necessarily selecting what's in their produce box as much as receiving what's able to be procured. And so, there's been a real insistence here on making sure that there's recipe cards so that if someone's getting something unfamiliar to them, they at least have some support in being able to prepare it.
Okay, great. Our next question is going to be from Rebecca Malatsky, and she asked me to ask this question on her behalf. What did you use to screen for food insecurity for Humana members, and how do you track it?
Well, I guess that one's probably for me. So we use the Hunger Vital assigned 2-item screener, which is asking about the worry about running out of food and also the physical absence of food. And as far as tracking, that's a great question. And currently we track in a couple of different ways. Obviously, there's a number of systems that different areas of our business uses. Even when we work with physicians, I think there's different EMRs. It's just all different. And so by building, really right now, it's more so the tracking comes in building the screeners into various systems and then being able to compile that into one place. So always a work in progress, kind of on that data compilation. But for the most part, we really just focus on making sure the screening questions are happening and embedded into different processes. And then, getting the data back is always part of the conversation, but at the moment is not less of a concern, but less of the focus. But again, always working on being able to pull that in from all those different sources and make it in a usable format. Unfortunately, I'm not in charge of that part because based on the answer of how we are getting it all in one place, very vague, but I trust that that's being worked on.
Okay, so we've got just a couple more minutes left, and we'll turn it over to the people on the phone to see if there's anybody on the phone who has a question and wasn't able to ask their question online. You can ask a question by hitting *7 on your phone and then asking your question. We'll give it give about 30 seconds here, and if nobody pipes up, then we will move on from there. Okay, I'm not hearing anything. So, Poonam, do you want to just mention the implementation guide that the panel has been referring to? And I did paste the link into the chat box for everybody to get connected to this. But do you want to tell folks a little bit about it?
Of course, thank you. So we did create this implementation guide over the past year, published it in February. The goal is to really provide some concrete strategies for how you can implement and maintain and sustain a food insecurity program at the healthcare entity level. As Jonathan mentioned, there is a link added to the chat box. This product is free, so there's no cost to access it. We really wanted to make sure it's available to everyone who would need it or want to use it. And if you have any questions, feel free to reach out to the team and so on. But again, thank you to everyone who listened in. This is a very important area, and we're so grateful that we were able to have our 3 panelists come in and speak on this. Jonathan, did you want to add anything else?
Well, we'll wrap it up there because we're just a little bit past the top of the hour. So let me just thank you, Poonam, and also our 3 panelists today for sharing your perspectives on COVID-19 and food insecurity with our NQF community. I'd like to also thank everybody on the phone for joining us today. We hope that the information that was shared will be informative as your organization attempts to address these challenges in your communities. We know that many of you are on the front lines of the response, and on behalf of everyone at NQF, we're grateful for your leadership and action. Please be on the lookout for a brief survey about today's program. If you could just take 60 seconds to give us your feedback, we would appreciate it. And I encourage everyone to tap into our amazing community of healthcare quality leaders. We have an active conversation underway on our online community, Member Connect. And the recording of this program will be posted there shortly, along with a link to that implementation guide that Poonam was talking about. So that concludes our program for today. Thank you again to everyone for joining us. And on behalf of everyone at NQF, we wish you continued good health amidst the COVID-19 pandemic.
Thanks, everybody.